The technology is now available where we could do genomic testing pretty easily. And what it allows us to do is assess how well medications will work in different patients. In effect, it's the discussion of personalized medicine.
Perfect. So if you can open up wide for me. Excellent.
We're here to talk a little bit about our pharmacogenomics clinics. Community pharmacists were, frontline healthcare providers that are dealing with medications on a daily basis. I thought, really, we should be the ones that are at the forefront of this new technology. We partnered with Genuine, a company that specializes in this type of stuff.
We actually take published guidelines that are coming from Clinical Pharmacogenetics Implementation Consortium. We take the DNA data and we take these clinical guidelines and we package it into one report using our proprietary software.
We have two interactions with the patient. The pharmacist will complete a medication review for the patient, take the sample, so the pharmacist will do a cheek swab, the patients actually do it themselves, we'll send it off. We don't actually send the results directly to the patients because some of the information I think can be a little bit confusing for a patient firsthand, so we invite them back to review the results. And that, on that kind of follow-up interview, it's not that difficult to interpret for a pharmacist, especially a pharmacist that has undergone training, but there definitely is, it's important that we have that discussion with the patient, help them understand why, certain drugs there's a, potential reason to intervene and why for others there's not.
Patients ask us, how can I change my treatment? And we are a group of geneticists. We are not qualified to give the specific advice how to make these changes. So that's why we started to work with community pharmacists, because they are qualified professionals to give advice on personal treatment optimization.
We're offering the service, but it's also, we're doing a study around it. So one of the things I'm interested in is practice research as well. And we want to see if this is something that's, we could roll out on a larger scale and maybe provide as a service in pharmacies.
It's a feasibility study that aims to demonstrate, first of all, how the process works. Second, how many pharmaceutical opinions that pharmacists provide based on pill check actually taken into consideration by physician. So it's actually the first study where the test is not only done, but also recommendations provided back to the patient right away, and also to treating physician.
Anecdotally, we know there's a lot of examples where the, pharmacogenetics plays a huge role. Plavix is a very good drug, clopidogrel. 30% of the patients don't activate the drug, and it's a prodrug. So we've had patients that have already come through the study where their new prescriptions for clopidogrel, we're able to test them now and see if they're fast, intermediate, slow metabolizers, and if they are not good metabolizers of the agents, the pharmacist can make recommendations for a different drug therapy. Genuine has donated the test to allow us to do the study. So right now we're not actually charging the patients. Somewhere down the line, I imagine patients would be able to pay for the service if they were interested in it. I'm sure some third-party payers as well may take interest in the results of the study, and it may be offered through extended health benefits through a drug plan or something like that. Personalized medicine, it's a buzzword out there. I mean, there's a lot of effort being put into this area. I think as the technologies become cheaper and it becomes cheaper to be able to do these genomic tests, I think we're going to see more and more people become involved. Healthcare providers will embrace it because it really does help us make better clinical decisions. And so that's ultimately what we want to do for our patients, right?